So today we have come to discuss about cardiac diet, that means healthy heart diet. Heart is very important organ in our body. It just weighs about 350 grams. Being such a small organ, it is very important and get protected anteriorly by chest muscles and bony cage, posteriorly by lungs and bony cage again. It has three coverings. Outer is called pericardium, middle one is called myocardium, which is made up of muscles, and the internal covering is called endocardium. Actually it's a muscular organ and it has to beat around 60 to 80 times per minute, and within a minute it has to pump out about 4.5 to 5 liters of blood. That means such a small organ is providing blood to all parts of our body. Not a single part of our body can perform without blood or its heart's activity. So this is very important, and a separate lecture has kept to know the nourishment of heart muscle. It's a muscular organ, so the muscular nourishment is more important. So the malnourished patients has many times cardiac impairment. That means many times the heart diseases or the heart problems are due to low nutrients to that myocardium. Let's see about the different diseases of heart. Normally the heart has the diseases which we know or we face is hyperlipidemia or high, that means the high cholesterol levels or the high fat levels in your blood. Second thing is hypertension. Normally the patient comes with the high blood pressure levels, that is called hypertension. And other diseases like myocardial infarct, CCF and ischemia, angina are the normal things which the patient comes and complains to you. And other diseases like arrhythmia, atherosclerosis. Arrhythmia means the heart cannot function properly or heart cannot beat properly. There is irregularity in the rhythm of heart. The normal things, that is atherosclerosis, means the internal lining of the artery get deposited by high levels of fat. Means normally the diseases what we are facing or the patients are facing are because of fat. So the first dietary restrictions come, that is fat. Let us know what is fat. The fat is nothing but the fatty acids and glycerol. The fatty acids and glycerol, that means the fat which is present in your blood, that is which we know is cholesterol and triglyceride. So let us know why this fat is important. Normally when the patient is coming to you, it complains of high levels of lipids in the blood. Then is these lipids are bad for you? No. These lipids are not bad for you, but sometimes the normal range of these lipids increases and that creates the problem for the patients. So let us see what is fat. Fat which is there in your blood is cholesterol and triglyceride. Normally fat is important because 1 gram of fat gives you 9 kilocalories, that is doubles of cholesterol and proteins which gives calorie less than the half of the fat which gives. So fat is more important in our day-to-day life or the day-to-day diet. Let us see what are the fat divided into. When you look at the fat, you come to know there are two types. One is visible fat and the other one is non-visible fat. Visible fat is the fat which you can see directly. Normally the animal fat or the vegetable seeds or fish oil, those are the visible fat. The second part is non-visible. That means the fat is present in the food but you cannot see it with your naked eyes. So normally the coconut, milk product, cottage cheese, normal cheese, paneers, creams, ice creams, these are the things, as well as fruits and vegetables, they also have fats in them but we cannot see it with naked eyes. So it is called invisible fat. When you eat fat, when you eat food, the fat goes into your blood. So according to the saturation, it has two again types. One is saturated fatty acids and the second one is unsaturated fatty acids. Saturated fatty acids are the fat fatty acid which are get saturate in your blood. These are very bad for heart patient, or which is very bad for the patients who are suffering from heart diseases. When it gets saturated means it increases your lipids in your blood. So let us know ki what are the saturated fatty acids. Saturated fatty acids are the acids which are not liquefy at the room temperature. Those are liquefy at the room temperature, they are unsaturated fatty